Good morning, everyone. Welcome to this panel on digital integration to support fighting NCDs. My name is Rob Cook. I'm currently Clinical Director of the Health Policy Practice at Economist Impact. Economist Impact is a relatively new research and consultancy arm for the Economist Group. It partners with clients who share the goals of improving global health in the pursuit of policy progress at all levels. It's my pleasure to welcome today 5 esteemed panelists. I'll do it in order from left to right. Dr. Taya Collins is lead for the World Health Organization's Global Non-Communicable Disease Platform. Next to her is Katie Dane, CEO of the NCD Alliance. Next to her is Professor Dr. Heo Kromer, who is CEO of the Charité Hospital, University Hospital in Berlin. Then we have Dr. Bernd Ohnesorger, who is President of Europe, Middle East and Africa for Siemens Healthineers. And next, and finally but not least on the end, we have Dr. Beatrice Vetter, who is Director of FIND. NCD Programme for FIND, yeah, sorry. Thanks for the reminder. So we're talking today about not just all digital integration and not all NCDs, but the intersection of both. So I'll take my seat and then I'll give them. So just a few words of introduction first. And then we'll go straight into questions while we have time for people to get a last coffee at breakfast and fill the room up. So digitalization is revolutionizing the way we live our lives, and it would also significantly shape the future of global health. It entails an unprecedented potential to improve healthcare services and brings new opportunities in the diagnostic and device sectors and for management of non-communicable diseases. The COVID pandemic has had mixed effects. In many ways, physical access to health services has become limited as facilities were preoccupied with COVID treatment. Furthermore, most NCD patients and people with NCDs were forced to stay home, especially those at high risk. Beyond the stress and anxiety, this also created a backlog for diagnosis and treatments. However, these challenges have also led, in some cases, to faster developments of digital health innovations. People with NCDs now stand to benefit from this new thrust of innovation. In our recently released white paper, The Intersection of Digital Health and Equity, Economist Impact highlights 4 pillars for digital health improvement: empowerment and access, accountability and justice, community and leadership, and finally, the importance of metrics. So clearly, to benefit from all the innovations possible, partnerships are key, working between governments, policymakers, the private sector, academia, IT specialists, civil societies, and others. Integration is also key. Today's session is about the policies which facilitate these partnerships and integration. We hope to also provide you with examples and relevant experience from the combined expertise of our panelists, with a focus on current best practice and future opportunities. Fragmentation of care is unsustainable. It leads to inefficiencies for hospital providers. It adds to the workload of already stretched clinicians, the loss of productivity, and altogether this leads to poorer global health. So I'd like to turn to Taya first to give her views of how you and your organisation view the importance of partnerships and where they can facilitate the integration of digital innovations for NCDs.
Is this? This is on. Well, thank you, Rob. Thank you so much. First of all, good morning, everyone. Really pleasure to be here. We all agree this is a very important session, so really thrilled to be part of this great panel. In terms of my organization, World Health Organization, I think more or less we are all familiar with this institution. WHO obviously is mandated to be the directing and coordinating body in global health, but we are also aware there were multiple sessions yesterday talking about partnerships, about the role of WHO. Actually, there is another parallel session speaking about 75 years of the organization, celebrating this and also acknowledging the importance, new players, new partners from not from international institutions, but also civil society, academia, and obviously governments, because governments are our member organizations and that's who we work with. But the convening power of WHO is widely acknowledged. But I want to really focus on NCDs and digital health and look at these two agendas really from the partnership lens. First of all, digital health is something that is also new, somewhat new to WHO as well, because what we're trying to do, number one, is understanding the clarity of purpose, why we're talking about digital health, because digitalization has been around quite some time, but we are now repurposing the digital tools and platforms to actually achieve health objectives. And that brings me also to the NCD agenda, which we realize very well, and it's great to have Katie here and Beatrice, who do work in the NCD area quite extensively. We know that we need to go beyond health systems and healthcare stakeholders for the multi-sectoral and multi-stakeholder approach, and so is digital health. So these two agendas, NCDs and digital health, are converging in this ambition to bring a lot of stakeholders from different sectors, and not only government sectors, but the private sector, and we have companies sitting here who are either producers or promoters. So we have a really complex global health landscape, and WHO has the mandate to convene and facilitate this, but particularly to provide normative guidance. But I want to also differentiate the WHO's role, where we are advising our member states and how they are engaging with different sectors. So I think this is also important, because we as a secretariat, we have our set of guidelines, but we also provide guidance to member states how to work in this complex landscape. So I think we will have the time to get down to the specifics and details, but as the overarching summary of the WHO's role is, first of all, we need to have clarity of the purpose, because whenever we work with other partners, we need to maximize health objectives, and so that's the number one goal. Number two is who are the partners, who are the actors, so that that has to be the right type of partnership who we work with. And the third piece is, and I want to also comment on this word of partnerships. Partnership is a very formalized way of working. For in WHO, we also have the whole spectrum of engaging with different partners. We do call them partners, but mostly stakeholders. It could be just a simple policy dialogue, because there are certain sectors where we can't engage. I mean, tobacco and arms, we don't even have a dialogue, but we may have dialogue with companies that affect risk factors of WHO, of NCDs, and that's a different level of engagement. So partnership is something where it's a full-fledged collaboration and more normally formalized. So I think it will be good to also have this great to what extent WHO really works with different actors. And it may not be partnership, but it doesn't mean that we don't collaborate. Thank you.
Thank you, Taya. That's a very nice policy lens. Secondly, the same question really for Katie from a civil society point of view, partnerships and how they facilitate integration.
Thanks, Rob, and good morning, everyone. So I guess just kind of starting off with, maybe some obvious points about the transformative role that digital can play in NCDs as a whole. I mean, if you look at non-communicable diseases, I'm not going to go into the statistics, everyone in this room knows, but NCDs are obviously the number one killer. They are the biggest global health challenge that there is. And for many low and middle income countries, that is the biggest burden that they're really dealing with within their health systems. Number two, it's the fact that there is this real lack of access to essential medicines and technologies for people living with NCDs in many parts of the world. Even though insulin has been around for 100 years, for example, many people with diabetes aren't receiving insulin because it's either too expensive or they can't get to a health service that's actually administering it. And then number 3, the specific characteristics of NCDs. You know, these are chronic conditions that most people have to deal with and live with for majority of their life, if not a very prolonged period of time. And so the reason why that is interesting and a real opportunity from a digital perspective is that, you know, obviously living with a chronic condition is a full-time job. And so the way that digital can actually kind of transform people's lives is actually by making it easier for people, by taking care into people's homes, as well as really kind of transforming the kind of, you know, early diagnosis, which is so important in the NCD space. You know, so much of NCDs, if diagnosed early, the complications, hospitalisation, premature mortality can all be avoided. And so the opportunity there from a digital perspective. As well as, you know, things like the fact that in NCDs, so much of care can actually be delivered at the primary healthcare level. Again, an opportunity from a digital perspective. So, you know, where partnerships, I think, so the opportunity is there in terms of digital and NCDs, no doubt, and we'll get into, I'm sure, throughout this conversation, the specifics around diagnosis and treatment, and the way that digital is playing a role. I think, you know, within the NCD space as a whole, as Taya has already shared, you know, partnerships, multi-sectoral action has always been a kind of founding block, you know, pillar of the NCD response ever since, you know, a decade ago with that first UN high-level meeting. You know, multi-sectoral action, no one sector can solve this issue alone, has always been kind of front and centre. Obviously, within the digital health space, there is a whole, you know, diverse set of stakeholders that need to be at the table and working together. Governments obviously need to be in the kind of driving seat in this, with the steering wheel in terms of where the priorities are from a digital and an NCD perspective. The private sector, tech companies, financiers, clinicians and health professionals, really importantly, as well as patients themselves. So there's a lot of different stakeholders to be thinking about within digital and NCDs. And obviously what partnerships can do is bring together some of those stakeholders to be driving action on a particular priority around digital and NCDs. I think, you know, I guess from our experience, you know, we're a global civil society alliance, so partnerships is kind of, you know, the bread and butter of what we do, both within civil society and across different stakeholders. I think in this space, particularly some, you know, lessons or principles for good partnerships in digital and NCDs are, you know, number one, ensuring that what the partnership is focused on is in line with government priorities and strategies. You know, so I think quite often what happens is that, you know, an NCD focal point in a low middle income country is trying to juggle all of these different competing initiatives within a country. And sometimes they don't always necessarily align and really support where the greatest need is. So I think, you know, that's kind of one of our first lessons, making sure that the partnership is working in line with the policy or the digital health or NCD plan within a country, and ideally working in partnership with the Ministry of Health, because that's where you'll really be able to get scale and sustainability of initiatives. Number two, as I say, really focus on where the need is the greatest. And that's, you know, sometimes easier said than done, but really trying to understand, you know, the, you know, data within a country of the challenges, of the barriers, where can digital solutions make the greatest difference, and focus on there. Number three, and I'm sure we'll be able to kind of build on this through the conversation, is have a really strong focus on, you know, co-creation. This came out of you know, many conversations yesterday as well. The importance of, when designing and developing digital solutions, you know, you need to have the user in mind, and in order to have the user in mind, you need to have them at the table. And when I say user, that's a horrible term. What we're meaning is people living with NCDs, patients, as well as health workers, you know, clinicians, because they're the ones that you need to have buy-in for. They need to see it as an opportunity rather than adding to their existing, you know, busy days. And yeah, I think I'll leave it there.
Thanks, Katie. No, it's interesting to hear us already getting a bit into the integration and the way that people work together as multidisciplinary stakeholders is probably a nice way of thinking about partnerships. So Professor Hare, next, could you give an idea maybe of research and on the ground university hospitals view of this? Yeah.
Well, yeah, I'd love to do that. And if you run a large hospital and try to approach the problem, the first question always is whether there's a medical need. And Kathy already lined out that the NCDs are the major killers. But there's another thing which really strengthens the question of medical need, which is a worldwide problem, which is in particular a problem in Germany. That's everything around the upcoming demography. It's not really widely accepted that, for example, my country will lose 1/3 of its workforce during the next 10 years to retirement. So 10 years from now, there'll be simply 60% of people available to provide care. And it's pretty obvious if you want to tackle with that, you have to integrate digital measures into the entire system. Otherwise, it will certainly not survive. At the same time, it's pretty clear that for the nurses and the doctors in our system, about 30% of their daily work can be readily replaced by digital measures. So there's a big issue which can be combined with the demography to solve this entire thing. So now, if you approach NCD, it's a question if you really want to, for example, do something like healthcare anywhere, that people are provided care in their homes by digital measures like the watch I'm carrying. You have to distinguish between the different types of disease. For example, cardiovascular disease offers a ready or a great potential to diagnose it by sensoric measures. So to have something really at home which can be readily be used by patients and also get you an alert if somebody gets worse or something gets worse. Same kind of was true for some psychiatric diseases. If you move to other NCDs like cancer, it's very, very different how to accompany people in that area. So we have to take care to find the appropriate clinical phenotypes to integrate these type of measures. So overall, I think it's a unique opportunity for the entire global health system in the NCD to get digitalization forward. And I would like to look at that or beyond that point in two issues. I think the entire system will only survive if we move a bit from intervention to prevention. And the entire preventive area can be based on digitalization. Again, if you have diseases, the phenotypes of which are accessible by sensoric means. And as sensors are in rapid progress, when from this watch you can get an ECG. And if you would have told somebody 10 years ago that you can get an ECG from your watch, I mean, people would have thought you're crazy. So if you think 10 years down the road, what might be possible then, I think it's something to really keep in mind. So the prevention issue in NCD is important clinically, and on the other hand, it's tackable by electronic devices. And last point I wanted to make regarding WHO. When you look at the digitalization in our countries, it always has been the way that we had large clinics, so we had big houses, and we tried to digitalize these houses. In other parts of the world, in particular, when you combine tackling NCDs with sensoric means, you could just go the other way around. You could start on the digital side and then kind of go back and find ways and means to establish the necessary hospitals. So you could just go the other way around than we did here, and you may be very successful in establishing these kind of retrograde systems. And that was what I think about it at this point.
Thanks very much. No, I think I can feel us getting more into the transformative role of digital innovations, and also actually a little bit of the examples from cancer, heart disease, hopefully diabetes. We'll cover all NCDs, mental health, etc. But I'd like to give Bern the opportunity just to make some opening remarks about the partnership thing.
Thank you, Rob. I mean, first, maybe let me join that side of the panel in underlining it's great that we have a dedicated panel now and focus on NCDs. I mean, this especially now in the post, quote-unquote, COVID era, while obviously a lot of attention still needs to be on pandemic preparedness. I mean, we all kind of feel and recognize that during the pandemic, the focus on NCDs got kind of diluted, while it's recognized it's still the number one killer and remains for a while. And that not limited to the developed economies, but also in the low and middle income countries. That is why I think it's very important, and also from a technology perspective, and we'll get deeper into it over the course of this panel, it is very viable and very vital that you have certain differentiation of the specificities of non-communicable disease and communicable disease, which have some common bases and common challenges, but also some specifics you want to have in mind when you develop technologies. We were joking a bit about that the title, digital integration, and I'd like to expand a bit also to sharpen minds on playing a bit on the words. I mean, when we speak also internally, I mean, how you take things from invention to innovation to integration. And that's invention is something you see, wow, a technology idea that can resonate. Innovation is when it starts to work. Integration is when it can work at scale. So this is why the discussion about how to deploy digitalization in NCDs at scale is really when it comes to integration. I will start a bit and we'll get deeper into other areas. I mean, obviously, Siemens Healthineers, my organization, is known for precision diagnosis and following treatments, especially in the NCDs of cancer and cardiovascular disease. But I want to start a bit more general from a medtech sector perspective. So we're Healthineers, you can look at it as a proxy for those. When you look at what is digital innovation, ultimately leading to integration, I think it's good to think along two categories. Actually, meeting the challenges that Heo Krömer also mentioned. One is really how can you deploy AI in order to increase precision and manage and meet ever-increasing demand. And the other angle is really telemedical innovations to virtualize and to decentralize deployment of technology, also to meet basically the demand in areas where staff is ultimately short. Staff shortage and filling the gap of human resources is actually an angle for both. About partnerships then, I mean, obviously the deployment of new technologies requires an incredibly deep collaboration of academia, of also provider networks that ultimately start to deploy technologies at scale, together with obviously the technology innovating companies and private sector along those lines. But I'll add the foundation, the governance, the legislation behind it, the deployment opportunities. That is where, I mean, together with NGOs, but especially governments, I mean, have to be in place. The infrastructure, the foundation has to be laid so that actually healthcare providers, academic or non-academic, with technology companies can work together, access data that is required for and have the possibility to innovate and to develop innovation based on that data. And then ultimately also have the right deployment legislation that enables it rather than prohibits the scaling of digital technologies. And this is an ecosystem we have to build together, and that's why it's great to have representatives of all of this around this table.
Thanks very much, Matt. So Beatrice, the same question, and I suppose from a diagnostics perspective, but also the settings at which we're trying to deliver this integration.
Sure, thanks, Rob. So, I mean, at Fine, partnerships are really at the core of our operating model. As a product development partnership NGO, we work towards equitable access to NCD diagnostics in LMICs through partnerships. And that means, on the one hand, we partner with developers of diagnostics, tests, and devices to enable availability of the solutions that meet the needs of the people living with NCDs and the health systems they live in. And on the other hand, we are partner with the country implementers, governments, local healthcare providers, and communities to jointly build the enabling environment. And that goes towards the co-creation, that is so critical for implementation of these diagnostics and their digital capabilities specifically in this case. So, but what do we mean when it comes to digital innovation in NCD diagnostic tools? I think from my point of view, there are three key aspects. One is use of the tests and devices that capture results digitally. And it's, we shouldn't take it for granted. A lot of NCD tools, and for infectious diseases also, results are still captured. The tests themselves, have manual readouts. So there's been quite a change in recent years to move that more to digitalized solutions, because we need easy longitudinal health monitoring and data sharing, of course. Then use of digital solutions for result interpretation and decision support. There's really great opportunities here. And the use of digital reach to build capacity around new technologies. And I want to give a few practical examples. So, for example, the first point, when it comes to tests and devices allow capturing and sharing of results, and how we partner here. So, for example, there we've partnered with users of devices and users of the data of the devices to understand what criteria an optimal test or device needs to fulfill in the environment. For example, now talking about diabetes, we work with over 300 people living with diabetes and their healthcare providers to develop a target product profile for new glucose self-monitoring technologies. And one aspect of this target product profile was really around the requirements of digital data capture and result sharing. Because as much as we all think we figured it out, we really need to ask exactly those users in country who live with the condition every day, who manage them at home and work together with their healthcare providers, to really then use those TPPs, target product profiles, to share with manufacturers and inform their development process. And then also, on the other hand, we partner with those manufacturers to assess the usability of the solution they've come up with. So that's an example on that aspect. And then when partnerships become critical in terms of digital solutions for result interpretation and decision support. So I want to first draw an example from tuberculosis, where FIND has partnered with health institutions, global organizations, and digital developers to collate an archive of chest X-ray images from different geographical regions. And that is then translated into computer-aided detection of TB. And that relies on AI to interpret the findings of the chest X-ray. And then this allows task shifting, right, to non-specialized healthcare providers and can dramatically increase the reach also with the move of making chest X-ray more point-of-care friendly. And in fact, the conversation has now started for the same around heart disease, because currently the TB chest X-ray can only tell you is it TB, yes or no, but if it's not TB, then there's no answer what else it is. And a similar setup, is worthwhile thinking about for heart diseases. And here, of course, the same types of stakeholders need to come together in partnership to build this and validate image libraries and put this in place. And thirdly, partnerships are critical when it comes to leveraging digital reach. So that's not necessarily about a technology itself, a diagnostic tool itself, but it's really about the digitalization of our world for capacity building, because new NCD technologies come to the market all the time. But of course, training often lags behind, and healthcare providers have not been trained during their medical training, and many of these technologies give a wealth of new data. General monitoring, blood glucose monitoring 24/7 gives a set of new data that can really improve diabetes care, and how to integrate that and how to make the right decisions needs training. And with the digital reach we have today and easily available, learning platforms, there's a great opportunity to leverage that to bring these technologies to the healthcare providers and people living with the conditions. I think I'll leave it at that. And we come to the settings. I think the primary healthcare settings, we come to that a little bit later.
Yes, no, that's good. We're going very fast into the examples here, which is always nice to go. So I've got a few questions for each panellist, and then we'll open it up to questions from the floor. And I'd like to drill down a little into the policy levers and the sort of opportunities, I suppose, that you're all beginning to mention in your fields for better integration. But in a sort of unusual way, focusing on the opportunities after the challenges doesn't make sense. So perhaps we should start with the challenges that organisations are facing in getting, particularly policy innovations for TEA. So what role can international organisations play in preparing the ground or the ecosystem that we're talking about for the adoption of these digital innovations?
Yes, thank you. I guess I'll try to stick with the global level, but maybe give a couple of examples from my experience at country level as well. So first of all, just to again be very clear, until you work at WHO, sometimes it seems very mysterious. What is it that this organization is producing so many documents that all look alike, and how are they going to actually help us do anything on the ground, and do we even need that? So I think I will address that challenge, more of an external challenge, because internally we think that we are very important and we produce good work. So it's been quite some time that digital health, I mean, it's been on the agenda of WHO quite some time. But if we look at the 21st century, in 2005, there was the first resolution that the World Health Assembly adopted that was on e-health at that time. Then there was another one in 2013, again on e-health. And what's interesting then, in 2018, e-health became a bit broader. And actually there was this resolution on digital health when the Director General was charged with preparing a whole-blown global strategy on digital health. In 2018, just leading to the strategy, WHO put forward the classification of digital health interventions, a shared language, basically, for all stakeholders, and that's the title of the document. And actually, I took the time at the time to read this because I found it very helpful. And why is that helpful is, first of all, how to frame the issue. And we're talking about partnerships and challenges, how we can work together. And if we don't speak the common language, and if we don't understand what is it that we're talking about? And even now when our panelists are speaking from their experience, we're covering many different levels. We're talking about policy, we're talking about health system challenges, we're talking about the barriers that are at the implementation management level. We're also talking about the user experiences and difficulties when you are actually a person living with NCDs, and Professor alluded to that. We did put together NCDs in an integrated manner to address a 5x5 agenda. But at some point, when you are talking about clinical interventions, you have to dismantle this and understand what are you exactly talking about. Are we talking about preventive measures when we just need to address physical activity or some behavioral modification challenges that could be addressed with a simple digital intervention such as SMS or daily reminders to go to your dentist? And we do have data that show that it's quite effective actually in terms of prevention. But when you go to a very difficult disease such as cancer, and also depending on which stage you are in and what kind of cancer you have and where you are in your life curve, we do see patients who don't respond. They don't want to know. And I mean, everybody has a family member or personal experience who've seen this, and you don't know. You know that there are tools, but they don't work. So I think this is something also to understand. So that's why I'm just going back again to the global level. And finally, in 2020, WHO put forward a strategy on digital health. And this strategy is, again, addressed to member states. And one of the major recommendations is to develop their own digital health strategies, because every country has similar issues, but they do have context-specific factors, and it has to be homegrown. Global strategies are it's like vanilla ice cream in a way, but then you need to add some topping that's relevant to you. So it cannot do this for you as a country. So I think this is important to keep in mind. And now, again, coming back to health and framing this issue, what's interesting is digital health is a very broad complex field, and people are talking about tools and interventions or platforms. All these things are used interchangeably. When we talk about telemedicine, that is actually a tool to deliver a health system intervention. That is the digital health intervention, and so this is what this classification really deals with, and the thinking that from the WHO's perspective to have some framework of understanding of tools, platforms, platforms, whether it's internet-based, non-internet-based. And what we're talking about is that to take every intervention and match it with health systems challenges. And we do have this health systems building blocks framework, which I think a lot of the stakeholders in global health community really use well. And that's like thinking in terms of health systems. So you look at governance challenges and see what kind of intervention will be most helpful. And there are actually tables provided for that match that intervention and then gives the delivery platform that would be most appropriate. So that's kind of nice table to think about this. And then if a particular challenge is, of course, with health workforce. And then just to give you an example, we work in Central Asian countries and Vietnam. We have a project on integration NCDs into MNCH, and we've done some research there, particularly on healthcare providers' use of digital health tools. And what's interesting is quality of care is one of the trends where we need to look at particularly why are we using digital health. And let's say there are guidelines, but there is poor adherence to these guidelines, and that impacts the care that providers are delivering. So what is the intervention? And the intervention is to, as an example, supportive supervision or continual feedback to providers, and that could be done by telemedicine. So that already frames your understanding and strategy, how you can use digital interventions at the health system level. So that this is the tool that WHO basically gives to countries, and that should be helpful to everyone. And then finally, it's also important when we talk about challenges and how can we actually implement these resolutions and tools that are provided. WHO suggests to have 4 types of users. So we talk about tools matched to health system, but also look at the users. Again, when we discuss these different tools and platforms, everybody means different end user. Most importantly will mean the patients who are obviously the target of healthcare systems. But the thing is, and especially going to digital health, this relationship is changing. Healthcare delivery models are changing. We have a very informed customer now, health service user. And so we have expert patients who know more sometimes than their healthcare provider. So how can you address this shift in this information asymmetry, as economists say, when your agent had more information now, but actually now you as a patient possess more information. So, and when you come to the provider, you need some kind of care at the point of delivery. But the chronic care requires continuity. And this is when digital health is super important, because we are not talking about replacing health systems completely. And also just keeping in mind that if the health system is broken, just introducing new tools and fancy equipment is not going to fix the problem. So that's why end user, and we have 4 types of end users that we suggest we need to think about once we introduce the platforms and tools. One is the patient, but is a person. Again, the language is also changing. We don't talk about patients, we're talking about people living with NCDs, because it's such a broad, we all have some kind of chronic condition, and you don't want to be labeled as a patient. Then we have healthcare providers, and this is somewhere where quality of care dimension, we work quite a lot on this, and actually I wanted to introduce this in BMJ. We actually published a couple of articles on online education, and also our survey that we did in Tajikistan and Kyrgyzstan. And so I put several issues there, but it's also available online. So we talk about healthcare workers, and this is something that's particularly important because they are the medium to deliver this care. And then we all, other than patient and person and provider, I'm just using the language in the document, they're health service managers. And actually, Katie really talked about this quite extensively, how difficult it is for healthcare managers and city managers and mental health managers when they're not they are overwhelmed. And also when you are introducing new tools, if you don't give them training and right incentives, they just don't take it. And then you wonder, why is that we're spending so much money and even donating equipment, but they're not being used because they just don't have time or don't have skills or don't have the incentives to even go and get trained and then start using a new tool in addition to the tasks that they already have. And then the final is that health systems and health data services and like the surveillance and information systems. So this is another end user in a way that we need to consider. So at WHO, you can imagine again that we are in touch with so many other stakeholders, speaking of partnerships, and everybody has their own issue that you need to take on board. And then in the end, you need to produce the document that can actually take a somewhat blanket approach that would suit everyone. So that's the biggest challenge that we have as an organization. And also now just to the final comment about the department where I work, it's Global NCD Platform. And so with our mandate is to engage basically with all the stakeholders, including civil society, private sector, and I mean, again, lovely to have Katie next to me because they're the greatest partners. Actually, also want to thank FIND because WHO just signed a memorandum of understanding with FIND, and I have to take credit about inserting NCDs there because it was a long list of areas where we can collaborate extensively. And somehow NCDs are always assumed and implied, but they don't make it to documents until you just say, but yeah, of course, that's important. But we have maternal and child health, and actually this is what I'm talking about in this PMJ too. We do work in maternal and child health, taking the life course approach and talking about these underlying conditions that we need to keep in mind. We have to have it reflected everywhere, otherwise it won't work. And then finally, what we're doing, we have two big units in the Global NCD Platform, Global Coordination Mechanism and UN Interagency Task Force. And UN Interagency Task Force is working now with colleagues in countries to develop an investment case for digital health, particularly for NCDs and mental health. And I want to keep adding mental health to our conversation because all research actually shows that emerged from COVID. One was, colleagues mentioned that telemedicine use was so much increased. But what's interesting is 3/4 of people commented that mental health was one of the issues that was most frequently addressed, that patients were more comfortable using telemedicine tools for mental health issues rather than maybe for cancer. So this is also something to consider. So we think that making the case, investment case, at the end of the day, if we don't invest, we won't get anything back. So we will be focusing on that and working. And then very, very final comments about the different levels of development that countries are in. It's wonderful when good diagnostics are available in countries, but sometimes countries are not at the level of development when they can actually absorb that and utilize that. And what we know, we work with ITU, actually we have programs like Be Healthy, Be Mobile, and ITU put forward this number. There are 7 billion mobile phone users, which is almost the number of people in the world. So basically people have more access to mobile phones than to clean water and sanitation. That's simple. That means that we already have a tool, a simple tool, but it can be a powerful tool to use. So that is very important. And then the final statistic, just to again complete, is that there is also research in the United States, like Pew Research Center put this forward, that adults who are accessing internet, 2/3 of them, they say that when they search internet, they Google it for health reasons, to get some health information. So we do know some. So we have some good data, but at the same time, we do need more research to just not have some anecdotal evidence or some numbers here and there, but a really good view of all countries. And so that's why we really need all of that to just really work together. And thank you for that, because these things really bother me, and I'd like to put this on the table. Thank you.
Thanks, Taya. That's a great overview, and we all love a good framework, and you've given us a lot more to go and find and dig out and look at, and particularly ones that focus on the people living with NCDs and their risk factors. So I'd like to move on to Katie, really. And for you, again, it's around how we prepare the ground, really, for adoption of some of the exciting toppings, I suppose I now think of them, as the ice cream topping areas of the NCDs. And so what challenges do you face, and how are you coping with those currently?
Yeah, I think, well, firstly, in terms of kind of the general roles that NGOs and civil society play in this field of digital and NCDs, and, I think that first and foremost, many of our members around the world, we've got 400 members, 80 national and regional NCD alliances around the world these days. And many of them are playing a really important role in terms of the kind of policy and advocacy side of digital and NCDs, because we can be producing all of these different digital solutions as much as we want, but unless you've actually got the buy-in from governments in terms of actually the focusing on digital as a priority, integrating it within existing health systems, as has been said, it's going to be very difficult. So the kind of advocacy side of it, I think, is really important. And that obviously, spreads across the global level, as well as, really importantly, where the rubber hits the road is the national and the community level as well. And obviously keeping kind of pressure on governments for commitments and targets that have been made around digital and NCDs as well. As we know, governments are very good at coming to the World Health Assembly or the UN and making these bold statements and promises, but actually what happens on the ground sometimes is a little bit different. So civil society can play a useful role in the kind of accountability side of that side of things. As well, I think another area that NGOs play a key role is actually obviously something that has been mentioned already, but it's that making sure that the policies and solutions are meeting the needs of communities, because we really straddle, civil society are obviously a really kind of trusted part of civil society, of the communities, and really understand what the greatest needs are, and particularly in terms of the inequities, because I think that's, probably going to be a common theme coming out of this and other digital sessions. It's how you ensure that you're actually tackling that digital divide and making sure that we're actually reaching the most vulnerable populations who are often completely left behind. So, NGOs play a key role in that regard. I think that the part where perhaps it's often forgotten of what the role of civil society is in digital health, it's actually being an implementer of many of these things, digital solutions. Just to give a couple of examples, American College of Cardiology is really at the kind of forefront of thinking through artificial intelligence solutions to assist in cardiology diagnosis and care. So you wouldn't necessarily always think that NGOs are kind of part of that picture of looking at innovation together with obviously the private sector as well. But I think that that's an important role, as well as, obviously developing, actual diagnostic tools as well. For example, cervical cancer diagnostic tools, which are really changing, making progress in terms of elimination of cervical cancer. Another kind of more implementer role, I would say, in terms of the NGO sector is providing digital patient support systems. And, I said this at the beginning, but, NCDs are chronic conditions. People live with them for most of their lives. That's the likelihood. And so constant support through, smartphones is a really effective way. And NGOs do a lot of that, whether that's kind of mental health support to communities, whether it's diabetes support groups. A lot of this is obviously done through digital these days. So again, kind of that's the role of NGOs. And then the final one I would say is kind of really capacity building and training. Something that we've talked about so far is the need to make sure that there's really strong and continuous training of healthcare workers, for example, around this transition or this switch to more digital solutions. For example, from going from using paper records within a primary healthcare centre to electronic records. That's not a straightforward switch. You need to really be investing in training for the health workforce to make sure that they see it as a useful tool and something that's going to be supporting their work. So again, NGOs play a big role in terms of the training and capacity building. One example of that is NCD Alliance has partnered with the American College of Cardiology and the World Heart Federation and Beatrice to develop what's called the NCD Academy, which is an online training program for particularly primary healthcare physicians across all of the different areas of NCDs, as well as kind of risk factors, all online. And there's many other examples of that, really. In terms of some of the challenges, and I think some of the challenges have already been picked up. But I think when we're talking about integration of digital solutions for NCDs, it does go back in large part to the fact that sometimes digital solutions are seen as a bit of an add-on rather than necessarily being, truly integrated into existing public health systems, private health systems, whatever it might be. And, unless it's really integrated and they're speaking to each other, obviously one of the main challenges is this kind of interoperability between apps, data systems, whatever it might be. And as I say, at the beginning, the importance of kind of having that partnership with the Ministry of Health can really, really help in that regard. If you look at what's happened in Rwanda around their kind of digital health system, one of the main, kind of starting points of that one was it being in partnership with the Ministry of Health to actually integrate the digital end-to-end service delivery platform with the public health system as much as the private health system. And then, other challenges, I think is, one of the generic kind of challenges that civil society, I think, face is, and it's not necessarily completely connected to digital, but I think it's an important one, is just a general shrinking of civic space in many low middle income countries. So even kind of our recognition of our role, whether it's in whatever part of the NCD space, is actually being kind of, shrunk in certain parts of the world, which obviously makes our job fairly difficult. I'll leave it there.
Right. Thanks very much. Yeah, you talk about workforce and training there as well, which I suppose is a good introduction to what Professor Quirmer might have to say, already has said actually. So I suppose delving a little bit more into the challenges in the hospitals and universities and research in this area, and particularly keeping the patient in mind, or the people living with these diseases and risk factors in mind. How can we help there?
Well, it's I think, an extremely interesting discussion because it covers various stages. And if you go a bit up, one of the, I think, urgent problems is a political one, because if you want to establish a system, what you described, you need to have an idea what is going to happen in the next 3 to 5 years and adjust your plans to that. And at least in my country, that's a very difficult political issue, to get anything done that lies 5 or 6 years ahead of us. And we really cannot kind of structurally cope with that. And to do it, I think you need really partnerships on one side on the national and on the international level. And sometimes emergencies kind of drive such type of partnerships. For example, in the COVID crisis, the German government came up with the idea, actively itself came up with the idea to combining all the 36 German medical schools into one network fighting COVID. And all of a sudden they realized what happens if you have a digital network of these 36 high-power hospitals. And now they think about taking this system, the network of university medicine in Germany, NUM, taking this system to the next type of diseases, which of course is then non-communicable diseases. So national networks are of paramount importance. And the next step also in self-organization happened. We have kind of connected the 10 largest European medical schools in the European University Hospital Association, and again we try to do the same thing on the European level to tackle these problems. What I thought was extremely interesting was the contribution with the iPhones, saying that more people than are alive on the earth have this kind of access to health. And I think this carries really interesting questions, because if you would go 15 years back, regardless whether you would be a construction worker or director of something, you would sit in front of your physician and he or her explains the world to you. And now you can access any information which is often beyond the knowledge of the individual physician from your phone. And if you have that, then your understanding, and with that, the participation in healthcare is directly related to your education. And I think that's a major thing. We should think about whether we want that and whether we want this type of development. And the last thing, which I think in future thoughts is of extreme importance, I think the public sector will not be able to tackle these problems by himself. We would need more than ever interaction between the public and the private sector. And if you work at these borders, there are some contrary interests, of course, and we really have to define this interaction better than we did it in the past. Because if we really want to go to digital integration and support the fight, in particular of NCDs, I don't think that this will work without the people who currently own these major platforms. So we have to have kind of a close interaction between the public interest and these private platforms or players like the Siemens company. And I think we have to define new roads of this type of interaction, and this, I think, would be of paramount importance.
That's a very nice segue to our next speaker. And, yeah, so I think maybe we'll come back to the phones and not necessarily smartphones, but digital text messaging, I suppose, is what we're talking about here. Is and it's whether that increases or decreases a digital divide. It's maybe not divided if we've all got more than one phone. Bernd, so the private sector, I suppose, is what we're talking about, and particularly some examples. I mean, we've heard about chest X-rays for the chronic disease of tuberculosis, if not communicable. But
now, happy to double-click in a few very tangible examples of where I believe, we're just about at the juncture of being able to unleash the opportunity to really deploy it at scale. And talking about NCDs, I actually love the example of TB and chest X-ray because it shows common challenge, but in a way different deployments, where NCDs in itself have different requirements than communicable disease, like TB, for example. And the example of the AI in TB and chest X-ray shows how difficult it is that AI can read a plain chest X-ray. In a way, it's encouraging that a year or a couple of years of experience of a radiologist is still hard to beat by a machine. At the same time, it shows the deployment of you have little data to work with. Obviously, you need lots of chest X-rays to train algorithms, but you have little data to at the point of care to make a decision of what kind of disease is it. In non-communicable diseases, the situation is a bit different because you have chronic status, you have very large data sets you need to work with and train your algorithms with. But at the same time, you need to make very differential diagnosis. That's the key difference between communicable and non-communicable disease, because non-communicable disease is much more personalized. Also, in the call, diagnostic tools have to make, versus in communicable disease is a bit more of a black and white and a more standard of care that's to follow through. And this, I think, to be kept very much in mind when you deploy these technologies and also when you develop it. When you go into NCDs in particular, I think where technical tools and digital tools, AI as well as networking and networked and telehealth solutions can make a very big difference, is number one, and I agree, I mentioned it, is an early detection. I mean, I think one of the secrets to success to beat cancer and to beat cardiovascular disease is early detection, if not screening. That requires at-scale deployment of sophisticated diagnostic tools and an amount of physicians and to make diagnostic decisions that would never exist. So at least not in from a human resource perspective. So this is where digital tools can help using early detection screening at scale to find cancer before it even can get dangerous, or to find cardiovascular disease before it can even also get dangerous. This next one is differential diagnosis to make very personalized treatment decisions. That is, I mean, to deploy AI tools to assist physicians. In this case, it is really about the best combination of man, women, and machines. Decades down the road, you never know what's going to happen, of how smart machines will get along those lines. But for the foreseeable future, it's still the best combination of human resource and AI tools that will make the best call to meet the increasing demand as well as to increase precision of the decision and the therapeutic decision to be made. And this ultimately, to find the disease and to diagnose it as accurately as possible, be it cancer, be it cardiac disease, to make the best treatment decision to cure it. So, and these are two examples where I really believe tools are about to be ready, some of them already in deployment. I mean, example of now in Europe, lung cancer screening coming into play, huge amounts of data sets that will be generated and they need to be read by man and machine, man, women and machine. Otherwise, that opportunity to save a lot of lives will not happen. And that's a very acute example. And to scale that then ultimately also in low-middle income country very soon is also going to be the next opportunity and challenge. It's a bit of both at the same time at hand. And lastly, the deployment of this a bit other connotation of digitalization, which means telehealth. This is where technology enables human beings to transport knowledge without flying, without spending CO2 in airplanes and so forth. And actually there is examples of already today medical boards, telehealth support happening remotely over continents. It's not necessarily only from one campus or from one hospital to the other on campus. It's also, there's an example actually, we work together with Charité on deploying cancer boards, clinical boards for oncology into the French-speaking part of Africa. So technology is there. It's about really building the infrastructure, deploying also the policies to scale it. Technology is, in this case, not the limiting factor.
Thanks very much. So I think we've covered a few nice examples of cancer, heart disease in hospitals or for imaging, largely based in hospitals. I wonder whether we could move now to sort of other settings. I know FIND work a lot in low-middle income settings, and whether NCDs in those settings, and primary care particularly in those settings, have disadvantaged communities in general, have different challenges, and what are the important things for us to think about within a primary care setting, how integration tools could be used.
Yeah, sure, thanks. And I think it's a good complementary viewpoint now to what you just said about the global level, personalized treatment, and tumor boards being brought to LMICs. But when we talk about the primary care level, we go back to very basic and very simple and, very real world often, right? The majority of the real world in LMICs is facing. So really NCD services at primary care are often limited to screening. So if a person comes to the primary healthcare facility, they get their blood pressure screened, they may get a blood sugar tested, but when any of these results are out of range, they get referred to a higher level of care because the physicians and nurses simply don't have the capacity or the knowledge to provide that chronic care over a period of time or even confirm a diagnosis. And of course, being referred to another facility poses a massive barrier. It's a massive risk of dropping out or being lost to follow-up because the next care facility is far away, the costs encountered, actually to going to that facility to get your diagnosis confirmed and linked to care. So I think integration of digital innovation, as I described earlier, as well as point-of-care testing, can here be a key enabler for providing that NCD diagnosis and linkage to care at PHC level. And while earlier I mentioned that really fancy example of digital chest X-ray for decision support is not rocket science. It's sometimes there's a digital result on a device, and then there's a color range indicator to say, is it above, below, or within range? And then you can make a decision based on that. And if that is linked with standardized treatment protocols such as the WHO package for essential non-communicable diseases services at primary healthcare, which provides for basic NCD care relatively simple protocols, then there's a tool to empower primary care to screen, confirm a diagnosis, and actually keep people in care. Of course, we also acknowledge that many conditions need specialized care ever so often, so not every primary healthcare facility can do an ophthalmology exam for a person living with diabetes ever so often, but the basic continuum of care to keep people engaged and to keep it close to their home can definitely be enabled with the use of digital, even easier than before. And I think you mentioned telehealth. I think I want to sort of also touch on that. What does that mean? Yes, telehealth can mean bringing loads of specialists from all over the world and making complicated diagnosis and personalized medicine. But in fact, I want to borrow a simple example from cervical cancer, a screening program in Ghana and Tanzania, where task shifting, and sort of telehealth was demonstrated through the use of what they call a CVR, smartphone enhanced visual inspection with acetic acid screening approach, where basically the nurses performed a traditional visual inspection with acetic acid for a cervical cancer screen, and also captured some images, and those images were together with were shared with a clinician, and the nurses proposed a diagnosis and treatment. Obviously, they'd received training on that before, and then once feedback was received, the nurses could implement the approach that had been agreed with the clinician. And there's a paper published that actually shows that method was found to be feasible and very effective in increasing nurses' skills and accuracy for screening, and as well as being highly acceptable by the women who are being screened, importantly. So I think that's critical, and we've also heard now about chronic conditions and the self-management and what does it mean to live with a chronic condition outside the facility. And here I think digital innovation can play a key role in management of the condition, not only through the data tracking and sharing of results with the healthcare provider and so forth, but really also through behavior change, encouragement, providing easy, accessible information, reminders, go to your appointment, nutrition advice, as well as communities. Right, encouragement is so critical to stick taking to your medication or the lifestyle changes that were recommended by the healthcare provider. And I think here, what we often overlook when we think about this, apps are great. We all have apps on our phone that sort of somehow track something, encourage us to do whatever. Probably some of you have already received some alerts on your phone that you should stand up because we've all been sitting too long, right? No one has really acted on it just now. You can if you want, right? So another challenge here. But it also means it needs to be adapted to the local context. Sort of what works for us here on a watch, on a smartphone, does not work for people in India or in Latin America or some in sub-Saharan Africa, because cultural context is so important, as well as language. We often overlook that English is not everybody's native language, and we need different languages, not only in semantics but quite literally and actually different translation to languages, which is now easily possible given the digitalization of our world. So that also plays a key role in reaching everybody and engaging everybody at any level of education.
Thanks very much. Thanks. So I thought we would take this opportunity for people to stand up when they ask a question. So to open the floor to questions, yes, please just stand up, state who you are. The microphone will come to you, and then state who you're asking the question to as well, I think. So first the man at the back, and then the lady at the front.
Hi. Good morning, everyone. My name is Tobias Luppe. I'm a Global Health Advisor with KfW, German Development Bank. I would like to take us a step back and congratulations to having this panel, because we know that the NCD area is still very much not focused on in international cooperation. And it's great that we discussed this here finally. There were hopes after the MDG area that we are finally moving away from the focus on infectious diseases and vertical programs, and we are going into integration with the SDGs, and then came COVID. And now everybody is on infectious disease and health security again, and again nobody seems to be really caring, at least in international cooperation, around NCDs. The German government just published its new strategy for health and development cooperation, and they purposely left out NCDs. Because it's like, well, we have a lack of resources here and we need to focus on something, and NCDs is something that doesn't really affect the developing world. It's not really important. So there's a lot of learning also to be done. But there is focus and there is attention and there's resources on pandemic prevention, including digital pandemic prevention, including building laboratory systems. And it's the question basically to WHO and maybe to find, but to anyone on the panel, how can we piggyback on this? How can we make use of the resources and the money that goes into pandemic prevention, into laboratories, into digital surveillance, into AI for data aggregation and screening and analysis? How can we piggyback on this and make use of these resources to foster the agenda of NCD treatment and diagnosis in developing countries? Thank you.
So two nominated speakers, but others can chip in as well, but maybe Thea first and Beatrice. So.
Well, thank you for this question. I think this is something that's That's been quite a challenge in global health for quite some time, that global health is organized in silos, and depending on the political different kind of where the wind is blowing, we have a lot of focus on maternal and child health, then we will focus on HIV and AIDS, and then we focus on NCDs because the high-level meeting is coming up. I think this is not like either or solution. It's very difficult to work this way, particularly once you start coming down from this global policy level to countries, health system level, and then when you reach the person. We did a lot of work at WHO with health surveys and documenting that people who were actually living with NCDs, they were the most susceptible ones to COVID infections and the worst health outcomes. So in people, all these diseases and conditions and behaviors, they're all integrated. So it's very difficult to have a person-centered care at primary care level, the way we talk about this, and having a holistic approach when you're just picking just one condition, and then when the person comes to you for help, you can't just turn them away because you gave them just one medicine for cough, and then you don't take a whole person approach. So we should take the whole person approach to global health as well. And in terms of backing, that's also something that implies in a way that some issues are more important than others, and somehow you need to divert these resources. And that's exactly what happened during the emergency. A lot of facilities were repurposed to attend to the COVID need, and that was the emergency that was justified. But at the same time, we're still dealing with consequences, and particularly because of delayed care, and particularly with cancer patients, the mortality did increase, but we were so occupied, the whole world, and busy to really tackle the immediate threat that we had to basically prioritize. But that, having said that, we have peace moments in between, and planning is extremely important. And it is important for particularly advocates, and Katie mentioned that there is so much room for policy and advocacy, because if we don't continue lobbying and advocating for the right causes and the whole global health agenda, and for more money and incentives for and investments in all health, and then prioritizing, of course, that's part of planning. But we can't afford as a global health community to just keep picking some favorite areas of health. That will always be the case. Some people will care for one cause or another, but it is extremely dangerous, and we need to learn this lesson from the COVID pandemic. It is extremely dangerous to completely neglect one area and just focus on another area, and then when it's over, you are left with even bigger challenges. So I think that's the only approach to go.
Okay, thanks so much. You can't really prioritise. Within health, you need to prioritise health as an investment. Really. Yeah. Anyway.
Yeah, I want to add to that. I mean, I think advocacy is the key, right? That infectious diseases, we've seen it during COVID-19, and we've, when others have leveraged that, the tragic finding that people who live with NCDs and uncontrolled NCDs are at higher risk of COVID, complications, and at higher risk of morbidity. And I think Katie, you said it, that pandemic preparedness must include NCDs, and strengthening and NCD care and improving that. And I think we couldn't agree more, right? The next pandemic is going to hit, and it is very likely that people living with NCDs are going to suffer more, than those who don't live with NCDs. And I think what I want to say to the question in terms of what can we do if governments, or government donors, development assistance is not including NCDs. I think in the NCD space, because of the limited funding, that's it's always been a problem. We're quite resourceful, right, and in trying to integrate, the questions we have and the visions and aims we have into infectious diseases activities. And it's increasingly also being picked up by, for example, the Global Fund now allows integration of diabetes in their TB programs. That doesn't come without challenges, but is moving in the right direction. The German government also has, for example, at FIND, we received support for COVID-19 diagnostics. We were able to leverage some of that for our diabetes work under that narrative of the comorbidities. So the visions and the understanding is there. Of course, we'd prefer if things were very much focused and dedicated to NCDs, but in the absence of that, I think there's a lot of opportunities, as much as we can, to talk about that interlinkage, that bidirectional effect, and leverage it.
Did you want to come in, Katie, and then we'll go for another question?
I just completely agree, and thank you for coming, given that the German government has just launched their strategy without NCDs being mentioned. It's quite mind-boggling, really. And it is a reflection of the broader development agency community, really, because out of all of the development agencies, it's actually only been Norway that has had a dedicated NCD strategy on for development cooperation, which shows how far we still have to go. And I completely agree with the need to focus on integration. I think it's a real pity within the PPPR conversations that we haven't had as much traction of the need to invest in healthy, resilient populations as part of pandemic prevention, because we've seen over the last 3 years that essentially the people who've been most vulnerable are people living with NCDs. Essentially, they're the ones that have been in hospitals or dying early or etc. So there hasn't been as much uptake, and I think that's partly due to the fact that the standard definition of PPPR is still the old one. It almost hasn't caught up with the kind of learnings of how COVID has evolved and what we need to be doing differently, kind of looking forward to other pandemics. As Beatrice said, I think there has been progress in piggybacking or integrating NCDs into other global health financing mechanisms like the Global Fund, like PEPFAR. So in the HIV/AIDS space, we've definitely been able to kind of build that stronger integration and to some extent within women and children's health as well. But I think the end, the main challenge we have is essentially, even with the advent of the Sustainable Development Goals in 2015, the global health architecture is by and large the same. And until that really starts evolving and really, it actually brings in integration into everything that the global health architecture is doing and how global health financing is dispensed, we're not really going to see too much traction. I think one of the opportunities from looking ahead is next year in 2024, WHO will be convening the second global NCD financing dialogue, the first of which was held in 2018 in Copenhagen in Denmark. That will be a real opportunity to be bringing the development banks, the development agencies, private sector, all different types of actors to really focus on what's working in terms of integrated, sustainable financing solutions for NCDs.
Thank you. I know Professor Kummer wants to come in maybe to defend the German point of view here, but can I take another question and then you can answer at the same time?
Just to this thing, a very short remark. I'm convinced that this will never be successful as long as you take NCDs as an overall goal, because the individual NCDs are so different. And if I would have to decide what to tackle, I would start with cardiovascular disease, because you have an immediate possibility to access the phenotypes on a very low price level. And therefore it's completely different from cancer or other NCDs. So I think one should differentiate where to tackle this problem.
Okay, thanks very much. Other questions? So one here in the front. Yeah. Middle. Yes, please, in the middle there. Sorry, no, if you sit down for a second. If you stand up and say who you are, then we can see. That's it.
Hello, my name is Muna Mude. I'm originally from Somalia, and I currently came from the USA. I'm so honored to be here, and thank you so much for covering this topic about digital integration. I'm from Sub-Saharan Africa, and I currently work for a digital health telemedicine organization. What we try to do is train and equip frontline health workers with telemedicine and digital health tools, but still there's a lot of challenges, especially working with internally displaced population. How can digital integration be effective if the infrastructure or the resources are still lacking? And usually when it comes to Sub-Saharan Africa, we see a lot of conversation around preventable diseases, like just the communicable diseases instead of like the NCDs. So how will even integrating digital health tools improve, even the data, the health metrics, because there isn't like advanced diagnostic tools that can support the aspect of digital development or digital health-related interventions in this type of settings. So I just wanted to ask about that as well.
And do you have any speaker in mind? I just want to avoid another half an hour answer when we've got another question.
I think I will ask Ms. Collins. to answer them.
Or I could take two questions. Maybe, if you can hold that question, Tia, and then we have a second question as well. Yeah.
Good morning. My name is Charity Muturi, lived experience champion. I live with a mental health condition and care for parents with 8 non-communicable diseases. My question is to Beatrice, because she had spoken about culture. The question I have is in terms of how can we co-create programs, and especially with culture, a lens in culture, but also looking at socioeconomic status. For example, a lot of the Twitter population in Kenya is the middle class and above. These are the people who will know when there's, calls for proposals, for apps and things like that. And when they think in that way, then the solutions, again, are for the middle class. It is the same middle class and the upper class who will access these apps and so on. However, for the poor, with an example of mental illness, for example, it is these things are assumed to be, the symptoms are assumed to be demonic or witchcraft. And because of that, we have people coming in for care 30 years after spiritual and traditional interventions. These people, even if some have smartphones, unless it is a religious leader speaking in that smartphone to say, go for treatment, then it means the having the smartphone is not the issue. If a politician says, go for, that therapy is good, then they are more likely to do so. How do we integrate that? Because I think we usually look at, do people have smartphones? But sometimes culture comes before that. So you find, like, for example, my father is a religious leader.
Can I just get them to answer the question? You come back after we've had the answer to the question, and then maybe you can give your example. But the question's around digital inclusion and culture, particularly in digital.
The example is part of what I am asking.
Okay, go on.
I'm sorry.
No, that's fine.
So to say that, for example, when I am going to speak in a church or a mosque, people will listen because I am the daughter of a religious leader, not because of my lived experience. Sometimes I'll get opportunities to go to media, and I know that lived experience is powerful, but because of the religious culture that we have, when I send a religious leader, they get better behavior change than, so I hope that's helpful in answering.
Lovely, thanks for your question. So first question around settings, and second around...
I'll try to be brief so everybody gets a chance. I think the main question is similar in a way. Thank you for raising this question, but mainly focusing on countries where there are low income, low resource settings, and how can we prioritize again and invest in digital solutions when there is some immediate need for infectious diseases. I think, again, it's a dangerous approach for us to say that, okay, infectious diseases are taken care of, we have solutions, and now we need to focus on NCDs or vice versa. We need to take care of all the issues. But what's important is, again, we talked just one solution. Obviously, it's more complex than that in 1 minute, what I can say. But it's very important to educate the customer and come down to the demand, because we do see this trend that people are requesting, they're demanding better quality care, and they're demanding their healthcare workers and their governments to give them what they deserve. And it is a human rights approach, really, to care. And so here, this digital health literacy and health literacy in general comes in. And by health literacy, I don't mean just the education when we give brochures or pamphlets and people can read and understand, but really practicing the skills and having the knowledge and ability to make this change and take care of yourselves, and also to ask your governments and your superiors, policymakers, to make this available to you. And that's where I guess we're now talking about. We can't solve the world's problems in one sitting, but there are enormous resources at the global level. And there is a lot of willingness from the private sector, from civil society, to have a seat at the table. And colleagues mentioned that governments alone cannot tackle these challenges of this magnitude. And here is something, there are solutions. And when it's much better to negotiate a better way of getting to health objectives and achieving better population health rather than shutting the door and trying to do it on your own. Today, we just can't do it alone. So we need to keep that in mind and not silo disease areas or different areas in global health, but really have the educated customer and really have the governments who are willing and open to collaboration.
I know Ben wants to come in as well quickly, if we can.
Just maybe to add, it's fully, does it work? Yeah. It's fully understood that in sub-Saharan Africa and many other parts of Africa or low middle income countries, I mean, we have to make sure that also first we have basics established. And yes, that technologies, and still your example of there's more people with access to smartphones than to clean water, let alone healthcare provision or healthcare technology, is obviously something we have to be very conscious of. Nevertheless, I mean, it has to be part of a midterm, at least midterm and at least long-term plan. And it's an obligation of the global society as well as then local governments that core technologies that are just inevitable get in place. And it's an obligation to technology innovators to think of what is core innovations, core technologies that are also accessible in the remote areas of Africa or other low and middle income countries, including like basic ultrasound, basic X-ray. There's just, at some point, you reach a limit of what you can do without technology, and this is why it has to come two ways: the attention locally and the governments for the healthcare system, and the innovativeness of technology companies that should continue to be directed in precision and high tech, but also in how can technology be more accessible at the point of care in low middle income countries, including automated reading tools that do a diagnosis where no physician will be around. So it has to be really both.
Okay, thanks very much. So the important question, I really like the example of that you gave. It's a fantastic example of how we can engage people with digital tools. So what about bringing culture into and the idea of digital?
Yeah, I mean, I think it's how to consider all the different aspects when designing those digital tools, right? And I really here think the only solution is to work with the local societies, because we need the people in country to educate us who will be the users of the fancy tools that will be developed, and then bring them all around the table. And often we also have a limited view, exactly to what you say. We look at those people who already use digital tools, we bring them together, and then think we've covered it all. But no, we need those people from more remote areas with different levels of education, with different religious beliefs, and bring them around the table, and that takes time. And we need to take that time. And we do have that really one nice example where we developed this target product profile for the new glucose self-monitoring technologies, where we try to do that in 4 different countries: Mali, Tanzania, Kyrgyzstan, and in Peru. And it was not easy, because we brought people that were recruited through the civil society sort of diabetes community, and we brought them together to help them think through the process of what they could need. But then it also needs a lot of background information to ask someone, what do you wish in a digital solution, when people have no idea. They've never seen that technology. They've never used the technology, like, for example, a continuous glucose monitoring device. So how can you then encourage them to think about it and what could work for them? So I think it takes time, right? It takes the local stakeholders and also, the will of the developers then to listen to that. Yeah.
1 or 2 minutes, actually, I've been told from the back. 1 minute question, 1 minute answer. Anyone for the last, or I'll wrap up.
Hello, my name is Marcel Schmude. I'm from Ada Health. And when we talked about prevention, we always talked about early detection and screening. But I think prevention starts earlier in risk reduction, as the most common diseases or NCDs, they usually have the same risks, like obesity. So we need to tackle nutrition, we need to tackle physical activity, smoking, alcohol drinking. And I was wondering, what are the strategies to tackle this? Because I think digital integration can especially help there to support the user in having a more healthy behavior.
Thanks very much. Who shall I ask that one to? Professor Bowman, perhaps cardiovascular risk and all its components in 1 minute.
Yeah, in 1 minute, right. In essence, what you say is that you have to move from a point of care to a point of pre-care. And I think these technologies offer a unique opportunity to do that. And at the other side, at least the aging societies in countries which are struck by that, like Germany, they won't have an option if we don't move to real prevention. And in one sentence, prevention so far is a failure because you tell people to eat apples, not drink beer, and you might get 2 years in 20 years from now, which is not really attractive. We can now go into a personalized, individualized prevention where you can identify the individual risk of an individual person, which shows its effects in very short time. And I'm convinced that prevention will go in that direction based on this technology.
Brilliant. I wish I could summarise so quickly. I'd just like you all to thank our panels. I won't sum up. It's been a fascinating discussion. We could have gone all afternoon as well. We were only just touching on the interesting things, culture and cardiovascular risk. But join me with thanking the panel.